Welcome to Healthy University, where we'll discuss issues and subjects on how you can live a healthier and more productive life. And now, here's your host for Healthy University, Alan Eisenberg.
Hi, and welcome to another episode of Healthy University. I am happy to say that at least where I am here in Virginia, it is finally springtime, and it's just gorgeous out. I took a walk earlier, and I know those of us that deal with things like seasonal affective disorder, SAD, this is the greatest time of year because it really brings us back to what life's all about. And I think, you're really going to get a lot out of today's show. It's going to be an interesting conversation. I have Dr. Natalie Phillips, who works at EarQ, and has all been focused on hearing impairment and bullying issues and a lot of other things I think that I've never even thought about in the bullying side of the community. So Dr. Phillips, welcome to Healthy University. What else do you want to tell us about yourself?
Thank you, Alan. I started with EarQ and am learning about the company, but what I love about it is that we are a prestigious nationwide network of independent hearing healthcare providers, and we also try to use some innovative business and marketing practices, as well as national public awareness efforts to advocate for excellence in our industry and patient care. We have about 1,400 hearing healthcare provider locations nationwide, and EarQ actually helps provide better access to quality hearing healthcare services and products. And so we work in the hearing healthcare industry and are a growing global consumer brand that focuses first on consumer education in order to really change the current healthcare model to impact the 80% of Americans with hearing loss who haven't been convinced to do something about it. Mm-hmm. We're hoping to rebrand hearing loss as a normal challenge and not a disability, and to really establish hearing loss solutions.
Yeah, it's I think where we're all coming from. I know, I'm working hard to break down the issue of mental health disability, or, in many cases, what is just mental health sickness for a period of time, and to lose the labeling. I think you probably see a lot of labeling in your world as well.
Oh, absolutely.
And, in my day job, I actually develop websites, and I'm actually one of the leaders in terms of making websites accessible. So I focus a lot on trying to get people to understand that, people who are seeing impaired, hearing impaired, physically impaired, all have the ability to utilize the web. And I'm always still amazed at how many people don't get it. It's just like, how can someone who can't hear watch TV or see the movies or and
I agree. Yeah, and I think the best way to break down this barrier and the stigmas that mental health may have, or even with vision or hearing, would just be truly education that leads to awareness and to combat some of these stigmas.
Exactly, and I think that's why we're doing this show, is really to talk about it, and you're certainly a professional in the field, but that everybody needs to play a part, and that I think there's a lot more self-actualization happening today, where you have to advocate for yourself and you have to advocate for your issues, because it's so big now. Everybody wants that attention, and that advocacy has become so important.
Right. And I think things like this show that you're doing, as well as the educational part, will help out. But also, in order to advocate for yourself, you need to have these mentors and these people who will guide you to being able to stand up for yourself.
Oh, yes. I mean, nothing can be done without great mentors. I have full belief in that. And certainly in the educational world and self-educational world, mentors are so important. So I think I'm really curious, how did EarQ and maybe yourself, as part of what you're doing, decide that bullying was going to be part of your mission and part of what you're doing as part of your company?
Yeah, well, I'll kind of start off with explaining what I get to do with EarQ, which, as the Director of Audiology, I get to advise in EarQ's educational content development for reaching consumers and our professionals. And usually the content is posted on our earq.com website, maybe our Facebook, Twitter, some other social media outlets. And we cover all sorts of topics that deal with hearing healthcare awareness, which could be hearing loss, maybe technology and everyday solutions for amplification or assistive listening devices, tinnitus and sound sensitivity, maybe dizziness, imbalance, vertigo, and many other disorders of the ear. And I also am able to engage our providers in connecting and collaborating with each other, because I truly believe that in order to learn from each other, we need to network, collaborate, and to be able to refine and provide our best practices. So I get to do that with EarQ, which is fascinating. And learning about how the company mission is and how bullying fits in, we really strive to tackle these stigmas that are still attached to hearing loss through our three prongs, which is innovation, awareness, and advocacy. And we are really trying to raise this awareness for hearing loss and for the challenges that it can create in many social settings, especially with family members and loved ones. Yeah. We advocate for people who have hearing loss. And, there are 1 billion teens worldwide that are suffering from hearing loss. We refer to this as the silent epidemic. If you look at who our population is, they're millennials today. And we have been focused in our industry at looking at baby boomers that are more susceptible to coming in for services and obtaining amplification. But if you look at the millennials today, I mean, just think about how many things that are available at the level of your ears right now, cell phones, earbuds, hearables that are all coming out. And it really starts with educating them early about how to listen carefully, how to be responsible, how to protect your ears, and especially now coming to the bullying part, how to not let hearing loss be a point of ridicule among kids. Yeah. We work on these things and we really try to get people involved. These kids and these parents themselves need to be educated and made aware of hearing loss to include the effects of what we call noise pollution. And then the next step would be where to get connected for services, where to get evaluated, maybe what's available in technology. What are the services that are provided by state and federal programs for funding, as well as aftercare? Where do they go for counseling, for auditory rehab, to gain the best success from using their devices? There's a large need to normalize hearing loss and hearing aids. And these kids that are typically being bullied, about things that can be seen, such as your weight or your physical stature, or, possible physical abnormalities or developmental disabilities that can be seen, kids are being bullied about hearing loss as well. And so the thing that is very scary about kids that have a hearing loss that are being bullied is that they can easily take off their hearing aids, and then they could have lifelong implications of speech and learning that we don't even know about.
Yeah, it's funny you even mentioned that. I spent my summer of my 18th year working for Variety Club Camps, which was a camp for disabled children. And it was funny. I had no idea that was the job I was taking. I thought it was just going to be a regular camp. And so I get there and I had a week long of, trying to learn how to sign as much as possible, because we were going to have a 10-year-old boy who was going to be hearing impaired. Mm-hmm. And he showed up and he covered his eyes. He was homesick and he covered his eyes. And no matter what we did, we couldn't work with him. He had to leave. And I always think of that. For some reason, it's just struck me, because the camp was such a great place where anyone with a disability could go and not feel disabled. And he just, was the one kid we couldn't do anything with, because you're right. If they take out their hearing aids, or, even if they're just totally can't hear, the thing that was striking me as I was thinking about our conversation was, in my day, I would talk about cyberbullying from the angle of someone would call me on the telephone when they were all landlines, and breathe heavy into it. And that was cyberbullying. And, I thought, well, what would a hearing impaired person go through? And I have to imagine today with cyberbullying and texting and all the websites and all the ways that they could read bullying instead of hearing it, it's got to have increased in your community.
Well, yeah, I agree. I mean, cyberbullying and things that, kids nowadays can bully from different avenues, to get to bother that one person. I mean, there's just so many things that can be done. And it's interesting. I go back to that camp that you were talking about, how interesting the different reactions are. Like that kid who he needed his sight to be able to communicate because he needed to see the signs. And he decided to cover his eyes. That was his way of shutting out the world.
Mm-hmm.
Maybe turning off his hearing aids or covering his eyes so that he can't use his other senses. I had actually talked to a few people to ask about what types of things with a hearing loss, how do you get bullied? What do they experience? And
Right.
It's not necessarily the same thing that other kids or teenagers might expect with more of these physical things that can be seen. But, some of the things that they talked to me about were, and I've seen this too, and I don't know if you've seen it, maybe it's just my world, but, fake sign language from across the room,
Yeah.
Slowing your speech down because you think they're slow, like they're not going to get it, really slowing it, over exaggerating your speech. The person that I had talked to too, he had said that people thought, his hearing loss and his hearing aids, that he was actually a toy. They would try to turn off his hearing aids from behind, or flick them off his ears. He also told me about times where kids would hold their hands over his hearing aids to engage what we call feedback, the high-pitched whistling that you hear from a hearing aid, and say out loud that it was a test of the emergency broadcast system. He actually even mentioned, and this was interesting that I thought, that he actually mentioned that even teachers thought that he was slower and didn't know what to do with him when he was in school.
Yeah.
And so there are different ways that kids with hearing loss do get bullied and teased and picked on.
And I would guess, sort of where you're going with the teacher thing, it's that same stigma, like because they can't hear, they must be slower,
Right.
and that teacher's playing that game, and that stigma then gets stuck. And I think we're wise enough to know now that schools are actually making decisions about our children and where they're going to fit, early. And
Oh,
so
yeah.
I would
Yeah.
imagine that that's very hard if, I've known a lot of parents who, want to mainstream their child who might be hearing impaired because that's an important element that they want in their lives. And to hear that might be happening because, they're mainstreaming them, but the school then is, really disempowering that person.
hmm
Um,
But it's interesting though. I mean, back in 2000, there was a study that stated that the average teenager with a hearing loss that graduated from high school, the median reading comprehension level was at a fourth grade level.
mm,
That was back in 2000, and since then we have shown that, that can be overcome, with the teachers, with the school. Now, I think the most recent thing that I've seen in 2008 and 2009, which is just 8, 9 years ago, that was done at a deaf school, said we're right on target, where we don't have that decreased reading comprehension level anymore. And so it can be done. I think that you have to work with teachers. I sometimes will even go to schools and engage with the school audiologists or the teachers of the classroom, show them the amazing technology that's out there, how to use it, how
mhm.
cool it is, maybe do some seminars or, I recently fit this cute little girl. She's 6 years old with a hearing aid, and she just lit up and took full ownership of taking care of her hearing aids. And, she came in for a follow-up, and I said, hey, how you doing at school? Are your friends asking you questions about it? And I said, I can always come out and talk to your teachers, talk to your friends. We could do a presentation together. And she just lit up. She just wanted to be all over that, to be able to educate her classroom. I thought it was so cute and amazing.
And I think that's great. I think it really is coming down to education. And in all our worlds, whether, it's hearing impairment or mental illness or physical disabilities, I think kids bring out to me the best in all of that because they're not shy to put it out there. You hear about a lot of the kids who will, talk to someone who came back from war, lost their leg or whatever, and meanwhile everyone else is staring at them, but the kid's willing to ask them what happened, and that's part of the educational part. But I'm really interested. You said something that really triggered me earlier, which I never thought of, which is we're all wearing headsets today. We're all, have earbuds in, and the idea that we could actually ignore other people. And I'm curious to see, if there's some of that going on where, you're actually putting that in. But we have to take a quick break. But when we come back, if we can hit on that, and I'd love to hear more about what we can do to create a better environment for people with hearing impairment as you continue your work in the field. Anyway, this is Alan Eisenberg with Healthy University, speaking with Dr. Natalie Phillips from EarQ, and we'll be right back.
You're listening to Healthy University with Alan Eisenberg.
Deep in a dark hole in the recesses of his mind, Alan tried to bury all the bad memories of the bullying that happened to him. But memories can't be buried, and he would be haunted by his youth and these memories for a very long time to come. Then he must confront and come to terms with his own youth and the things that happened to him. Find out what Alan didn't want to remember. Read A Ladder in the Dark, My Journey from Bullying to Self-Acceptance. Available now at Amazon, Barnes & Noble, and most major book retail outlets. Welcome back to Healthy University. This is Alan Eisenberg, and I'm here with Natalie Phillips. She is a doctor in the audiology area working for EarQ and has been actually working on the issue of bullying and the hearing community or the hearing impairment community. So welcome back, Dr. Phillips. I'm so glad you could be here. I wanted to hit on this idea. You had talked about like earbuds or how people actually use techniques to, not to ignore hearing impaired people or treat them differently. What have you seen in that community? I mean, what has that been like?
Yeah, well, there's a couple of points that I can talk about. Number one, let's talk about safety of hearing first. Let's tackle that one first. A lot of the times with these, we had talked about different hearables and earbuds that people are wearing at the level of their ear. Yeah, I mean, you can definitely put those devices in your ears, crank up the sound. And a lot of people have questions as far as how loud is too loud. I basically go on the rule of for my kids. And then also I talked to somebody next to me on the plane because he was listening to something through his earbuds and I could hear it. So if I can hear what you're hearing sitting right next to you, it's too loud. And so, yes, there are ways that you can definitely tune people out that way from a hearing world. But also when you look at the other issue of people that are hearing impaired, that have a hearing loss, and they are wearing their hearing aids or they are wearing their cochlear implant. I have been in different cases where I went out with a person that had a cochlear implant, and we were having a friendly little, argument, and all he did was he flicked that cochlear implant magnet off his head and looked away, and I couldn't do anything about it, and I was so frustrated. I was like, put that thing back on. There are definite things that they can do, which is kind of scary, because if you think about the kids that are in the schools, you don't know when their hearing aids are on or off. You don't know if the battery's dead. We have to educate these kids, these parents, these teachers to be aware of making sure that hearing aid is on, whether they're turning it off on purpose, whether they are not knowing how to take care of their hearing aids. Manufacturers have been absolutely great about coming up with ideas of how to make sure this communication of whether or not that hearing aid is on for that child can be seen by the teacher. So they've come up with visual indicators that are on these hearing aids that will flash lights, so that a teacher knows if something's not working right. There's a lot of different things that we could be doing with these kids that are in the schools. And so, talking about tuning yourself out, sometimes it's not really, on purpose. Sometimes it is. And so we've got to weed that out. But again, it comes back to the education of everybody involved in the education of these kids.
Yeah. And as part of that, like, self-advocacy, I mean, I even know I had a child with ADHD, and that topic just kept coming up. Like, he's got to self-advocate. He's got to self-advocate. Is that heavy in the hearing impairment community as well? Like, do they really want the kids to be the one to self-advocate for themselves on these issues?
Anything, and it doesn't even have to be about hearing loss, but how important is it for you to be able to learn about what's going on with either if it's your body or, something that you need to overcome? How much better would it be if you would be able to take ownership of that and responsibility? And so with anything, it's something that we as audiologists, we as hearing healthcare providers, really make sure that the families that are all involved and the teachers, when working with these kids, really try to push that they have to own this responsibility. When I have kids that come in and I fit them with hearing aids, I don't look at the parents and teach them how to take care of it. I will sit with the kid, the child, and show them how to take care of their hearing aids, get them involved. When you treat somebody as a real person, it makes them more empowered. They want to be able to show you that they can do this.
Right. And, the other part that I'm really curious about is with the device or with the earbuds and all that, do you feel like you're seeing an increase now in people with hearing problems, like slight hearing problems because they've been wearing earbuds? Is there any study around, it's like you said, that person who was next to you had it so cranked up that they could hear, you could hear it. That's loud.
Oh, yeah.
Are you seeing an increase?
Oh, yes. I mean, I've been an audiologist for close to 20 years now. And average age that we were fitting on hearing aids were probably, your baby boomers, your maybe 50, maybe 60-year-olds and higher. Within the last, I would say 10 years even, the average age that I'm fitting on hearing aids are anywhere between the ages of 35 or 40 to 60 years of age, a much younger population. We're all still in the workforce. We are all missing out on different meetings, and we're finding out, two things. Number one, they're more susceptible to this noise pollution, to just the normal wear and tear of ears, whatever we're doing at the level of our ears now. But we're also finding out with the improvement of hearing aid technology that we can get people into hearing aids at an earlier point in their life where they will be successful and they will learn that they'll be able to preserve their hearing better because they're getting that stimulation to the nerve earlier. Whereas if they wait until they're 70 or 80 years old and the clarity of their hearing is not there anymore, they won't be as successful using hearing aids as if they used it or started when they were younger.
Yeah. Do you work with both children, I assume you do, who have a hearing problem and also possibly a mental illness problem that goes with it?
I have a handful of patients that have that, but not a whole lot.
Because a lot of what I've heard and actually have experienced is a lot of the medicines that end up playing into mental support or mental illness can put a ringing in the ear. And I actually experienced this at one point, and it was, it was quite scary, to
Yes.
have a constant ringing.
Oh, yes, it's called tinnitus,
Yeah.
and I'm actually a tinnitus provider
Mm,
and a sound sensitivity, and I work with sound sensitivity. And what I found out in about the 15 years that I've worked with tinnitus patients is that there are common things that can exacerbate tinnitus, and medications are definitely one thing. The sad thing about it is we're learning that tinnitus, or this ringing in the ear, actually takes place in the brain, even though it starts at the
mm,
level of the ear, but it goes up to the brain where it's detected and perceived and evaluated, and it lingers there. And some of the more common things that we're finding are stress levels alone, medications, like you said, a hearing loss, exposure to loud sounds. And the unfortunate thing is sometimes, even if you were able to identify the trigger of what may have started the tinnitus
mm.
or exacerbated it, and even if you were to try to remove it, does not necessarily mean that the sound level will be reduced, because it is in the brain now. It's something that we actually have to retrain in order for you to reduce the awareness and disturbance of tinnitus.
Yeah, I actually feel very lucky, because what I really discovered, and I think in the end was true, is that it was stress and anxiety related. The exacerbation, at least, was. So while the medicine may have, set the ringing on, it was still that aspect of stress and for me, anxiety. And when I finally learned to overcome those things, I don't, unless I get stressed again, and then I know, wow, there's that ringing again.
Well,
and,
good.
and there's the Advil that I need to take real quickly.
Mhm.
But yeah, I feel lucky, because I actually have a mother and father-in-law who both have ringing, and have been living with it for years. And my father-in-law was a farmer, so you can imagine he was around loud sounds all the time.
Exactly. Yep. Mhm.
And we're pretty sure that's, for him, where it came from. So I had one sort of like funny sort of thing to ask you, since I have you here, before I want to give you a chance to talk more about how people can get in touch with you about what we're talking about. But yeah, I had read somewhere that, we all have the ability to actually tune people out. So like, if if we're very argumentative with our spouses, or I even remember as a kid, like, my mom or dad would be like, "Why aren't you listening to me?" And there were times where I thought, I can't hear them. I actually thought maybe I'm going deaf.
Mhm.
How real is that? How real is the idea that you can, they're hitting on the frequency here, and you actually start to not hear it?
Okay, so I have this conversation with my patients all the time, because I have spouses that come in all the time. And it is kind of a funny question, because, there is this difference between hearing and listening.
Mm,
And I think the brain is a strong thing where we can learn to tune things out. Now, whether or not it's a true manifestation of a hearing loss, sometimes it's not. Sometimes you have completely normal hearing. I cannot tell you how many times I have brought my husband into the office and said, I swear you have a hearing loss. I put him in the booth, I test him, and I am so mad that he has normal hearing. But you know what? Then I can say that it's the listening part. So unfortunately, my family does not get easily off the hook. But yes, we can definitely learn how to tune people out. You do this throughout your whole lifetime. You focus on the things that are important, and you tune out the other things, at the time that you really need to focus. Now, that being said, I have to talk about hearing loss, because the speech spectrum, is anywhere from what we call 250 hertz to 8,000 hertz. So there's not a specific frequency that just females or wives talk at. But in the normal progression of hearing loss, what we're seeing a lot is that high frequencies tend to go first. So when high frequencies tend to go first, just from the normal wear and tear of the ears, I mean, that's the section of the inner ear that gets hit every single time from the middle ear hitting into that inner ear. And so the hair cells are dying off in that section. And what we're seeing is that high frequency hearing loss can be transposed to softer consonants, consonants that don't have voice behind it, which would be things like S's and T's, F's, P's, hearing cat versus cap, so an animal, cat versus something that you wear on your head, a cap, okay? And so the beginnings and endings of words are what people start to notice first. And what we're seeing also is that they struggle to hear in noisy environments, because any type of noise in your environment will cover even more of what you can't hear. And so, it could be somewhat of truth that when high frequencies tend to go first, you don't hear as much. You also, because these things, your brain gets a little lazy. This is what I tell my patients, where things that are soft, things that are in the distance, you just don't pay attention to it as much because it takes effort to pay attention. And so when your spouse is saying, honey, can you please grab the blah, 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 and trails off and turns around and walks down the hall, you're going to miss one or two words here. And if you don't have the strategies in place to say, excuse me, honey, could you please turn around and repeat that to me? And if you're just saying what or huh every single time, this is where the frustration comes in. This is where the communication breakdown comes in. And there is somewhat of a real, hearing and listening, depending on what the hearing loss looks like. But you're right. Even as a kid, you probably didn't have hearing loss back then. But with kids, it's an attention thing too. If they're focused on something, they will not necessarily tune in to what mom or dad are saying.
Yeah.
So.
And what's funny with me, what I always tell people, so my background is really that I use the word empath. I'm a very sympathetic. I have a lot of sympathetic feelings, and because of that, I feel things a little more. And it's interesting because I think now we're starting to realize, this is another, a lot of group that gets bullied. Obviously, if you're very empathic and you have a lot of caring about people, you're an easy target. It's a blessing and a curse like everything else. But when you talk about like crowds, if I'm in a crowded space, I'm actually so, it's so overwhelming because I'm feeling this sensitivity as well. So I'm almost paying attention to everyone around me, and I hear nothing. It's a very interesting idea. And I think, a lot of men talk about, I know there's a lot of talk about male Venus and the idea that, men can only hear one thing and women are built to be able to, have kids yelling in one ear and some other people yelling in another. And I often wonder how true that is. It was a great time, believe it or not. Our time is up. But it was so great to talk to you because you bring another world to the conversation about not only about bullying, but about health and about, a community of people that probably doesn't get the full attention they deserve because, again, it's a community that is, not to be flippant, but that, they don't hear. So therefore, there's probably a feeling of being ignored in the overall community.
Yes.
And, those are the things that I look forward to seeing changed. All of these issues that we talk about on Healthy University are ones that we're going, I think in the future, I feel good that we're finally addressing, people. We used to, and you talked about baby boomers a bit, we used to look at people in more of a group aspect. And I think, even millennials on, everything's becoming much more individualized. We're looking at the individuals a lot more, I feel like. And I think that's where we're going to win is when we actually start to recognize that there are no, everybody doesn't have the same thing. So to say everybody who is hearing impaired is dealing with the exact same thing, is wrong. And it's the same thing in PTSD community or all of these. We really have to look more holistically at each individual story.
I completely agree.
Yeah, so I'm so glad you were on the show. I want to give you a chance to tell people how to get in touch with you and your organization and what they can do. So
Great.
how can they reach you?
I am enjoying being a part of EarQ, and we are dedicated to reach our consumers and the 80% again of people who have a hearing loss that are not getting into offices to be evaluated, and ultimately trying to preserve what they do and trying to get them to be proactive. So in addition to being part of EarQ, I also get to be a part of HearStrong, which in 2013, EarQ took some resources and knowledge and launched the HearStrong Foundation to empower and help educate people with and without hearing loss by recognizing both HearStrong champions, where we highlight the accomplishments of everyday people with hearing loss, as well as HearStrong ambassadors, those people out there who can be champions themselves or have a passion to help advocate for hearing loss awareness. And, we strive to create an environment where hearing loss and the appropriate solutions are really nothing different from what other people face. And we do this by telling stories about everyday people, whether they may be student athletes, musicians, social evangelists, all with hearing loss that are accomplishing many goals that even people without a hearing loss may not be doing. And you can visit the EarQ.com website. You can visit the HearStrong.org website as well. And it's something that we really need to continue to collaborate with as many people as possible to get this campaign going.
Yeah, and I will have those links up with the podcast here. I really want to thank you. This has been eye-opening and I'll say ear-opening for me. So learning a lot more about your community, and I'm glad we've been able to connect and give the hearing impaired community, which is dealing with a whole set of individual issues within that, a chance to talk on Healthy University and get the word out. So I hope it was a good time for you, and I really enjoyed having you. I think it's a great conversation, and obviously there's more to be discussed.
Thank you.
So
really
maybe down the road.
Opportunity.
Yeah, you're so welcome. And again, maybe there'll be more to discuss that we'll hit on later. So I would look forward to that.
Sounds fabulous.
All right. Well, thank you, Dr. Phillips. And again, you can reach her through EarQ, which can be looked up on the web easily, and I'll have links right there on the blog story. So for now, this is Alan Eisenberg. Thank you for joining me for Healthy University. Have a great day.
Thank you for listening to Healthy University, brought to you by Bullying Recovery, LLC. This podcast does not replace the need for medical advice, professional diagnosis, opinion, treatment, or services to you or any other individual. The information provided here or through linkages to other sites is not a substitute for medical or professional care, and you should not use the information in place of a visit, call, consultation, or the advice of your physician or other healthcare provider. Join us next time for more Healthy University.